While the aid of international healthcare is quite active on the ground in affected islands, there is limited capacity at the Rand Memorial Hospital on Grand Bahama and one field clinic operational at this time. While Abaco has one operational hospital with 3 of its 10 clinics, that is, with limited capacity, but the global response is enormous. A call for medical assistance was sent out in the wake of Hurricane Dorian, which has left the Bahamas with quite possibly the largest humanitarian crisis in the country. Officials from the Pan American Health Organization and World Health Organization's representative, Dr. Esther de Gorval, telling ZNS News one response was to provide an alternative to the Rand Memorial Hospital.
So we have, working with partners, got the Samaritan's Purse to set up a mobile hospital on site at Rand Memorial to provide for movement of the patients who are there in the facility currently to a temporary location, which allows time and access for the cleaning of Rand Memorial Hospital, repair of equipment, and so on.
Samaritan's Purse can provide medical care for up to 100 outpatient cases per day with 40 beds. It is ready to respond at a moment's notice in any emergency. Dr. de Gorval says the facilities in Abaco were also assessed.
Medical services are once more being offered at Marsh Harbor Clinic. We have also medical facilities operational at Foxtown Clinic, Cooperstown Clinic, and Sandy Point. And these yellow circles with the question marks indicate those clinics which are still to be evaluated and made operational again. One of our major priorities is to ensure access to health care for persons who remain on the island.
A number of international medical teams are on the ground assisting in varying capacities, but the PAHO WHO representative says surveillance remains a high priority.
One must remember that even in normal times, there are cases of diarrhea and fever and other conditions reported. So what we look for in an emergency situation like this is any indication of an increase in numbers beyond the normal trends, and that has not been seen. There have been rumors, but the reporting system that has been put in place does not suggest that there's any increased numbers of infectious diseases.
At last report, the death toll stood at 50. As for concerns of underreporting of the dead or quarantine on affected islands,
there is concerted effort to do a grid system across both islands to systematically search for any deceased persons, and we anticipate that the numbers would increase, but the numbers that have been reported so far have been based on the retrieval. There is no need for quarantine because we have not seen any increase in any infectious conditions that would warrant quarantine.